Hello, my name is Fatma Gamal Ahmed, is clinical instructor of maternity and neonatal health nursing. I will explain breast self-examination. It is a procedure. This procedure is consisted of 3 parts. Part 1, it is preparation of procedure. Part 2, steps of procedure. Part 3, post-procedure. Part 1, the preparations of procedure. Preparation for 4 items. Number 1, preparation for equipment to save the time, effort, and energy, such as disposable gloves. Number 2, preparations of environment by close the door and windows and trapping the mother, expose the area of examination. Number 3, preparations for woman by explain procedure to the woman to gain cooperation and relieving anxiety. Number 4, preparations for myself by washing the hand and wearing the gloves. The part 2, the steps of procedure. In these steps of procedure, using 2, inspection and palpation. When using inspection, put the mother's tooth position, the sitting position and the supine position. When using sitting position, use 3 positions. Wheels are inside the body. And number 2, when an arm over the head. Number 3, using the arm on hip and pressing to contract the chest. Okay. When using the supine position, using the arm over the head and inspect the breast. Okay. When inspect the breast to the symmetrical. Okay. When using the right arm on the overhead to inspecting the right breast for any disorder, abnormalities such as redness, ulcer, rash, any abnormalities for breast, for color, for nipple, and inspecting the symmetrical for 2 breast, and repeating this step to another side. Number 2, the palpation. When using palpation for 3 items. For palpations to examining the breast. Number 2, palpations for underarm. Number 3, palpations for nipple. Number 1, when palpations the breast, the mother asks mother to putting in the supine position and her arm, the right arm over the head, and palpation the right breast. Palpation for what? Palpation the breast by using the pads of finger flat together and using by gentle pressure for all breast by circular motion. Move down to the nipple until the nipple. Okay, and repeating this step to the another breast to detecting any abnormalities such as lump, nodes, any abnormalities of the breast. Number 2, when check the underarm using the right side or left side, and should be examine the 2 sides. When using the underarm, put the mother in the supine position and her arm, the right arm, over the head and examine the right arm. Right for what? Using a cupping of finger to palpate underarm, the lymph node to detect any node, any abnormalities, lump by deeply pressure. Okay. Cover all underarm until to the breast. And repeating this step to another side to detecting any lymph node, any abnormalities such as nodes or tenderness or lump. Number 3, examine the nipple. Examine the areola by inspection to detecting any abnormalities and palpate it and squeezing the nipple by 2 fingers, the thumb and the index. Between the index and the thumb, squeezing the nipple to detect any discharge. Discharge for what? In colors, any discharge such as yellowish, greenish, bleeding. Contact your doctor immediately. After procedure, help the mother to go down from the table and remove the gloves and wash your hand to prevent the cross of infection, and record the finding for any abnormalities to early detection, any abnormalities and the early treatment for these abnormalities. It's okay, thank you.